welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender for the 19th Judicial Circuit. We are going to be talking about some things today that I don't think we've ever talked about on this show exactly. And with us today is Donna Harris. And Donna, you are the Health Education Specialist. You have a long title.
Well, I'm a certified health educator, and I work for the St. Lucie County Health Department doing health education programs.
And you have been with them how long?
About 15 years off and on.
Okay. And we're going to talk about a little later in the show some of the other things you do within the health department and for the community, et cetera. But tell us, you have a very exciting thing going on, you and the health department, called the Teen Zone.
Yes.
So before we get into the other things, tell us about Teen Zone. Wow.
Well, Teen Zone is a reproductive health clinic for teenagers aged 13 to 19. It began as a community project between the health department, the Roundtable of St. Lucie, Children's Services Council, Kids Connected by Design, and Healthy Start, as a way to increase access to reproductive health care for teenagers.
And what do you mean? I mean, we all know what reproductive, but I mean, what exactly does that cover?
It covers STD testing and treatment,
okay,
family planning, pregnancy testing, and education.
Okay. And so what is it? I mean, do you have to apply to learn about these? I mean, how does it work?
It is a walk-in clinic. The reason we began about 4 years ago was that we have a lot of programs in the county working on teen pregnancy prevention and STD prevention.
Well, let's stop you right there.
Okay.
What kind of, give us some statistics about teen pregnancy and STDs in St. Lucie County.
Teen pregnancy, and that's my background. That's what I've done for most of my career. Teen pregnancy at one time in this county was just off the charts.
Yeah,
yes.
I know.
And we have, with a lot of partnerships, worked on it from a variety of different levels. We have education, we have programming in schools, we have just a number of different avenues, everything from delaying sexual activity with the younger kids through my program, which actually deals with family planning. So what we found was all of these programs were working very well, but we would have these kids that were sexually active, and they weren't receiving much education on how to protect themselves. They really didn't understand how STDs worked. They didn't really understand how birth control and condoms worked. And they didn't have a place. They weren't insured. And even if they were insured, they didn't usually access their family doctor for these issues.
Right.
So they were just coming to the health department for pregnancy tests, and they'd be negative, and we'd be like, okay, but what do we do with this kid?
Oh, I see. Yeah. Now, again, in my ignorance, and let me stop you there, is there an age limit or that you, I mean, let's say I'm 13 years old, I don't have insurance. Can I walk into the health department by myself and get a pregnancy test?
Yes.
Oh, wow. Okay.
Now, and let me differentiate between the regular health department clinic, which runs, 5 days a week. You have to have an appointment to go there.
Right.
And the idea behind Teen Zone is there were a lot of barriers that teenagers faced. Some were real, some were just in their minds, but they were facing barriers, and that's why they didn't access services. So making an appointment, if you're 15, they don't understand how to do it. It requires a lot of additional planning. They weren't real good at that. The cost factor. If you come to the health department or a private provider or Florida Community Health Center, there is a cost. Now, for teens, it's usually waived, but walking in the door, they go through eligibility and they perceive there's going to be a cost. And as soon as they have that idea, they, never mind.
Oh, yeah.
So cost is a huge thing. And then confidentiality. They worry about going to the health department clinic with everybody else and any clinic. They're just
seeing somebody they know.
Right. And a lot of it is just they don't understand the medical. They haven't ever dealt with it on their own before. A parent or someone has always done it, and this is an issue that they don't usually want to involve parents in. Although I will say that we have a lot of parents that talk to us, and a lot of the parents are very involved. But some of the kids have that fear. So we looked at all these barriers, and we developed a walk-in clinic. We're open twice a month for set hours. We're run with a lot of volunteer help.
And where is this located?
It's located at the Health Department Clinic on Milner Drive, which is off of Midway Road.
Oh, okay. It's not downtown Fort Pierce.
No. It's at the clinic in Port St. Lucie.
Okay.
And part of that is that there are services in the Fort Pierce area. There really isn't anything for teenagers or any really family planning services out there, public services. So
and I stopped you, Donna, and I'm sorry. You're open twice a month.
Twice a month on the first and the third Tuesday.
Okay.
We open at 2 o'clock. It's totally walk-in, so first come, first serve.
And you close?
We close at 6 o'clock. We'll take the last client at 6 o'clock. We're often there. We had Teen Zone last night. We were there till 8:30. So it just we'll be there till the last client is done.
Right.
And gotten home.
And what does Teen Zone offer?
We offer STD testing. If you come in, our protocol is all new clients will get tested, which is also different from a normal family planning clinic. Normally, if you went to the doctor for family planning, they wouldn't give you an STD test unless you ask for it, or unless you just told them, you had some symptom that they might think is an STD. So what we do with the new clients is everybody gets tested. It's just part of the visit. You come in, you talk to a triage person. You can tell them all your fears, your concerns. What do you need? What do you think you need?
And again, let me stop you there. When you say a teen by themselves, or a teen has to be with a parent, or you'll take both parent and child?
We will take both parent and child, although we do ask that we have a little bit of time with if the teen wants a parent with them, certainly they're welcome. But we will ask at certain points they need to let us talk to the child alone.
Okay.
In the state of Florida, the Florida statute says that anyone over 13 and over can get STD testing and treatment without parental consent. That's across the board.
And I didn't realize it was, okay.
Family planning, birth control is a little different.
Yeah, tell us about that.
There are certain categories of kids that automatically, if you're emancipated legally, if you're a parent yourself, or if you're married, you're allowed to get family planning without parental consent.
And that means what?
That you can get birth control pills or Depo shots, which are the two types of birth control we offer. But in the Florida statutes, there is also a provision that if a provider sees a teenager 13 and over, and they feel that that teenager is at risk for an unplanned pregnancy, which the state considers a bad outcome for a teenager.
Sure.
And that provider there is a series of things they have to discuss with them: abstinence, parental involvement. They have to go over their health history.
And this is listed in the statute?
It's in the Florida statute.
Wow.
And if they meet that and they discuss these issues with them and they sign saying that I feel this teen will get pregnant if we do not treat them, then we are not required to have parental consent.
Wow.
And, I've had parents that call me and say, how can you do this? And I'm like, it's the Florida statute.
It's the law.
And, and most parents, once we talk to them for a little while and we say, look, this child, and I say child, most of our kids are really like 17, 18, 19.
Right.
A lot of them are working, they're college kids, we really do see very few of the very young kids.
Okay.
But to me, they're all children.
Yeah. And I'm sorry, you said 13 to what age?
19.
Okay.
So right
okay.
up until the 20th birthday, which also sets Teen Zone apart because there are some other programs that work with that 13 to 17. Florida Community Health Center has a walk-in clinic for teenagers.
Okay.
But only up until their 18th birthday. Once they hit 18, they're an adult in the eyes of the law, and there are no other places where they can get a reduced rate.
Okay.
And even at Florida Community, the depot shot still has a cost attached to it.
And I hate to,
I know it's
what are depot shots?
Depot is Depo-Provera. It's a hormonal type of birth control. It works very similar to the way that birth control pills work.
Okay.
The big difference is that you get it is an injection, and you get it once, and it's good for 3 months. So for some of the teens who just don't deal well with remembering to take a pill every day, they like the Depo shot. And we are the only place right now where you can get that without a cost.
Wow. So they have to come in every 3 months and get another shot? Okay.
Yes.
And they can do that up until the age of
up until their 20th birthday, yes.
Wow. Okay. Okay, so and then you offer and I'm sorry I'm interrupting because this is
That's fine.
New territory, if you will. Then the other forms of birth control would be, of course, the birth control pills.
We have birth control pills, and we have 3 different types. We're a Title X clinic at the health department, so our supplies are right on site. So we're able to hand someone birth control pills that day that they come in for their appointment.
Oh.
We don't,
or give them the Depo shot.
Or give them the Depo. We're not giving them a prescription to go out and then have to locate that.
Right.
And although I have had actually very few in 4 years, I do carry a phone around with me all the time that people can call me on. It's on our website. And I do have a few parents who've questioned us doing this, have questioned whether this is a good idea. And my argument is that they're coming to us, these kids. They're very uneducated. They're very ignorant of how their bodies work, how getting pregnant works.
Well, so many adults are ignorant.
Yes.
I mean, it's not just the children. I mean, it's amazing.
Half of all pregnancies in this country across all ages are unplanned.
Oh, I know. And when you think back, it's just amazing to me. You talk to, adults that, are 35, 40, and they said, well, I got pregnant again. We were going to be divorced soon, but I just don't know how it happened because, and I'm like, well,
let me explain that. And so, many adults and many parents are uncomfortable talking to their own child about this.
Sure.
This is something, even as someone who's done this for many years, when it's your own child, it is more difficult.
Sure.
And I'm very educated on this topic, so it's a lot easier for me to talk to someone else's.
A stranger.
Yes.
Yeah.
And I have done many, many classes over the years. I don't get to do that anymore, but in years past, I did a lot of education out in the field with teenagers, and I was just astounded at how they just don't understand what prevents pregnancy. They don't understand how STDs are transmitted.
Right.
They don't understand what the risks are. And I'll give you an example. In doing a class, I had a question from a boy. He's probably 15, 16. And he asked me if it was true that Mountain Dew, if you drank enough Mountain Dew, that would decrease your sperm count, and then you couldn't get a girl pregnant. And being a professional,
now I've never heard that one.
I just took it very seriously because I find the kids respond to that, and I'm like, no, that's totally untrue. And I was kind of thinking he's just messing with me because they try to shock you, and sometimes I'm thinking, I've never heard that before. That can't possibly be a rumor. That can't possibly be a theory that people are thinking.
Promulgating, yeah.
And yet, I started telling that story when I would do other presentations, and every time there were kids who had heard that. I did a large seminar for adults where there were some college students. Every college student, oh yes, we've heard that. Now they said they didn't believe it, of course, but they had heard it, and
that's
so
amazing.
that's pretty out there.
Yeah.
But we've heard many times from the girls that we counsel that are pregnant. We have a program at the health department that case manages pregnant teenagers.
Right.
And we've interviewed them and done focus groups over the years, and what you often hear is they weren't planning to get pregnant, it just happened.
Right.
It just happened. And that they thought they couldn't get pregnant. I never got pregnant before. The doctor said it might be hard for me to get pregnant. My boyfriend, I thought he was sterile. He said he was sterile.
Yeah, right.
There's a lot. We kept hearing that, and I actually thought that can't really be what people think. But there was a recent research study that showed that in young women, and that was up to about age, 26 or 30 something, the prime age to get pregnant, that a huge percentage of women thought, for whatever reason, that they would not get pregnant, that maybe they had periods that were erratic, or they had endometriosis, and the doctor had somewhere said that could make it difficult, but in their minds, they could not get pregnant.
Right.
And those are all those unplanned pregnancies, because it's a lot easier to get pregnant than people believe.
Well, now, other than the birth control pills and the Depo shots, now you don't have IUD. I mean, you have a doctor on site, I presume.
We have a medical director. The providers that we have are nurse practitioners.
Oh, okay.
And we have some wonderfully dedicated, and they're volunteers. They come from other jobs to come there and work.
Really?
We have about, right now, 4 ARNPs, nurse practitioners, and they rotate between we do 2 clinics a month, so some of them do one and some do the other. And we have probably 5 or 6 RNs that rotate.
Wow.
We have a midwife, we have an LPN, we have a lab person, and they are all just coming in and donating their time because they have worked in family planning for many years.
Right. And they realize the importance. Yeah.
They've raised teenage daughters, or they work in the field, and they see, we've had nurses that were working in the obstetricians' offices or at the hospital delivering babies, and they see what happens, and they see how many of these kids come through.
Now, okay, so let me stop you there for a moment. So we've got the birth control kind of covered with the shots and the pills, period, basically, or I'm sure you have condoms,
yes,
whatever.
We have condoms, yes. We're the health department.
Yeah, right, okay. Now, and then you do the STD testing.
Yes, sexually transmitted diseases. We do HIV, gonorrhea, chlamydia, and syphilis testing, which are the 4 major ones that you would see.
Is that one blood test? Or
gonorrhea, syphilis and HIV are a blood test.
Right.
We don't do rapid testing at Teen Zone, and that's just because we're...
What do you mean rapid testing?
You can get rapid testing for HIV where they just scrape the inside of your cheek and they can give you the results very quickly, like 15, 20 minutes.
Oh, really?
Our blood test takes 2 weeks. Even if you do the rapid testing and it comes back positive, you would still have to do a blood test to confirm.
So you do that up front?
We just do the blood test. It gives our people, our STD people at the health department, when you get somebody that's positive, it comes up in the system, and within 7 days, they will contact that person and get them treated.
So no news is good news, kind of on that.
Yes. If no one calls you,
in 2 weeks, you're probably okay, right?
But with the HIV, we want, if it's a teenager, knock on wood, we have not had any HIV positives at Teen Zone.
Really? But I'm sure you've had STD positives.
Yes. Chlamydia, on the other hand, we see many, many cases of chlamydia. And chlamydia, both boys and girls get it. We see both boys and girls. And it's not so serious in the short term, and it can be treated very easily with antibiotics. However, it is one of the leading causes of infertility because it leads to pelvic inflammatory disease.
Oh, I see. Right.
So if you had chlamydia at 14, 15 and it never got cleared and you never treated it, at 35 when you decide you choose to get pregnant, then you may not be able to. So
wow.
it can lead to long-term damage.
So if you are tested for the 4 major HIV, etc., and the blood work comes back that you have HIV and syphilis, let's say, what happens then? You contact the child and then you get them on a treatment plan? Or
yes, the health department has an entire department dedicated to surveillance of STDs.
Okay. Now, and maybe you answered this before, but this is important. They're in there. Can they be tested for these things without parental consent?
Yes.
Okay, so can they be treated?
Yes.
For the, okay.
Sexually transmitted diseases, there is statute that says anyone 13 and over, and that's mainly just because of the HIV epidemic, I think is the reason it went into law, but anyone 13 and older can be tested and treated for STDs without parental permission.
And HIV, I'm sorry for my ignorance, HIV is considered a sexually transmitted disease? Okay.
Yes. The main way that the human I'm not going to be able to say that.
It's all right. It's all right.
HIV leads to AIDS.
Right.
HIV is treated. There's a cocktail of drugs that they're used. It's almost become a chronic disease. We're not quite, but people live a long time with it now.
Right. It's not the years ago, when you said AIDS or HIV, it was like a death sentence.
And at one point in Fort Pierce, we were one of the top, not numbers, but the rate. So the rate for our population was very, very high. We have cut that by 60% in this county.
Wow.
We have really put a lot of resources and time and effort, and if someone came up positive for HIV, Teen Zone or anywhere else, they are immediately surrounded with services.
Okay.
There's case management. There's a whole package of services that would come into play.
And this is with or without insurance then? This can be?
Yes.
Okay.
Now, it's always better to have insurance.
Well, of course.
But yes, there are programs in place.
Well, I guess why I'm saying that, obviously most of us are paying for insurance, and you can hear the other side of the story too. But the reality is, you certainly don't want a child or an adult to have HIV or AIDS and not get treated because they think that they don't have insurance, so they can't afford it. I mean, and I know the expense of treatment for these diseases is expensive.
By treating them, you're reducing the transmission tremendously. So
now, let me stop.
Sure.
I can't believe it. We're almost out of time. But when you say reduced the AIDS epidemic, I guess, by 60%, are you saying that through your education and all of that stuff, we have 60% less people having AIDS, or 60% less dying from AIDS?
That statistic refers to, and please don't quote me exactly on the numbers, I don't have it in front of me, but the reduction is in new people becoming infected.
Well, no, that's wonderful.
And it's really been a huge community effort. Places like Teen Zone where you can get tested. There are places around the county you can get tested, many, many places and programs that work with getting people educated and tested. A large program of people that work with HIV clients, making sure that they get their medication. that they get the services they need. And then a few years ago, we fought very hard and got an HIV prevention curriculum into the school system, which was a change in policy. And we're seeing the results of that now, that the
Obviously, wow.
Kids coming to us at Teen Zone are more likely to be using a condom than they were 4 or 5 years ago.
Okay. Now, what about STDs? Have you reduced the...
Yes.
How much on that? I'm just...
I don't... Off the top of my head, I don't remember the exact percentage, but we have, for a long time, when you look at the charts, STD rates for the state and for St. Lucie were going like this.
Right.
For bacterial STDs. The Florida is still pretty much going that way.
Right.
We went up, and now we're coming back down.
Oh, wow.
So
Great.
we've kind of bent the curve on that. It's still,
and again, it's the cooperation within the school system and the educate. Wow, that's it. And what about pregnancy?
Oh, pregnancy is
way down.
Way down.
Right.
We last year in 2000, well, the latest numbers we have are 2012. We had 245 teen pregnancies, 15 to 19 years old.
You're kidding. Wow.
10 years before that, it was closer to 400.
I was going to say.
And what's interesting, if you go back to like the 70s, it was off the charts.
Right, right.
So definitely, and that's 2 reasons. One is education, and kids are delaying sex. The HIV epidemic.
And you really think they are? I mean,
yes.
That's amazing.
They're
because you have the, the free love and
culture, and it's
wow.
unfortunate. The culture gives them a really bad message because most of the kids we see, and I say the kids that come to Teen Zone, these are the responsible kids in the community. These are the kids who say, I'm behaving this, I'm doing this, I'm having sex. I need to protect myself. I don't want to get pregnant.
Others.
Protect others. I need to know my status. And, I'm going to college. I have a job. I
don't want to mess it up.
I don't want an unplanned pregnancy. So,
Donna, just wrapping it up real quick. If Teen Zone, you can go online. And what's the phone number?
They can go online at teenzoneslc.org.
Okay.
That has all the numbers and the hours and the times and days and what to expect at your appointment.
And then they can call.
They can call my office number at 772-785-6184. And then if the teens have a question, they can call me on my cell at 772-940.
Okay, they call the other number and get
call the other number and get that number.
Okay, Donna.
I'm so sorry. I don't have it in front of me.
Okay. Thank you so much. This was a great show and very informative.
Thank you. I can come back anytime and talk about Teen Zone.
Okay, thanks.